legislature.
Welcome to TMA's Legislative News Hotline for Friday, May 24th. I'm Brent Anir. Thanks for watching. Sine die, or the end of the legislative session, is just hours away. TMA is calling this an outstanding session. But why? For one last update of the items on our 2013 agenda, we've pulled in the experts. TMA Vice President of Advocacy, Darren Whitehurst, and TMA Vice President of Communications, Steve Levine. Gentlemen?
Thank you, Brent. You know, this really has been a heck of a session for medicine, Darren. The legislature's really delivered for doctors and patients. Why do you think that happened?
Well, again, I think it starts early. I think that we took a very good preventive approach, is that did a good job educating legislators back in their district before the session. I think had a good game plan in the political cycle and getting people elected that really look out to their doctors to understand medicine's issues, and I think that paid dividends in the legislature.
Well, certainly, you know, we've had a couple turnarounds compared to where we were last session. The budgetary issues are not nearly as tight as they were then. But let's take a look, for example, at women's health services. That's one of the ones we haven't talked about much in the video hotline so far. Last session, we had some big cuts in women's health services. This session, we've got that repaired. Plus, the legislature came up with a sort of a new way for the state to help deliver services to low-income women. Can you tell us a little bit about that?
Just a little bit about it. We had a coalition that we were participating in. Dr. Riolini was spearheaded the efforts relating to the coalition. But I think that in sort of all the strategy areas, we had significant increases over where we were last session, and actually before that, I think that we had as good a session as I've ever been involved with relating to women's health services. You know, funding for things like family planning, the community primary care services, and then the women's health program itself all saw significant increases in funding. So I think it's all really very, very positive on that front.
Well, it's certainly a nice change from where we were this time 2 years ago. Let's talk, speaking of 2 years ago, House Bill 300 in the 2011 session set up a brand new privacy law here in Texas, and in some cases it was tougher and did a better job of protecting patients than HIPAA did. But there were some problems that doctors had in terms of implementing it. So we got two bills that are just about through the session right now that are going to fix that. Yeah,
again, it had a lot of concerns raised during the interim from physicians relating to employee training. So I think really made some advancements on what's required on training and tried to set those up to coincide with a lot of the stuff that's required by HIPAA right now. Also, there were some notification requirements, and it was unclear in House Bill 300 from last session. Did you have to comply with Texas law? Did you have to comply with HIPAA? Did you have to comply with the law of the state that the patient is from? And basically said you only have to comply with Texas law, so that you don't have all of these competing requirements for physicians. So I think made it much cleaner, much easier for physicians to understand, and hopefully we'll see that on the implementation side.
So it's part of our red tape elimination strategy.
Right.
Two bills I think we're really excited about that can eliminate hundreds of forms really that doctors have to go through when they're requesting prior authorization, either for medications or for medical procedures. Both of those are almost to the finish line right now. What are they going to mean for doctors?
Well, again, as I think just what you said is that hopefully we'll cut through some of this bureaucracy and red tape, some of the paperwork. It basically sets up a work group that will look at developing a standardized prior authorization form, as you said, for both pharmacy and for medical services. And actually the drug prior auth legislation just got concurred on the Senate side, so it's going to be on its way to the governor's desk, and we're hoping 1216 is not far behind.
And so that would be a single form for each one, not a multitudinous.
That's right.
Forms.
So instead of having to deal with Aetna's form relating to it, or Cigna or Blue Cross or United, is really tries to develop a standard form that doctors can use in order to get prior authorization.
And some of those plans have multiple forms themselves. So.
Absolutely.
So more red tape that we're doing away with. I hope it makes a difference, and let's doctors spend more time with their patients.
We'll be keeping a close eye on to make sure that it does.
A bill that the governor has already signed is one that we haven't discussed much. It's sort of the Truth in Advertising Scope of Practice bill. Requires people who are working in a hospital to have certain things on their tag. Can you tell us about that one?
Well, yeah, just sort of what you talked about. And what we've seen in other states is, I think that people today are oftentimes very confused. Everybody wears scrubs in the hospital, so you don't know who the physician is versus, a nurse versus a tech. And so this basically makes you put your credentials on a label that you have on you in the hospital, so that they can see who the physician is, they can see and know who the nurse is, they can see and know who a lab tech or whoever, all very integral parts of the team, but lets the patient have a better idea of who's actually seeing them and who's actually providing treatment to them.
Well, a lot of times these days, people are calling themselves doctor, delivering their care. We've got doctors in nursing practice, we've got doctors in physical therapy. So those people could be on a hospital staff, but according to this bill, at least patients should have less confusion about who those people are versus who the MD and the DO is.
That's exactly right.
One last bill we want to talk about, and this is probably the only one we're going to talk about today that's still kind of up in the air in terms of where it's going, and that's the big franchise tax bill. There's some important things in there that should reduce franchise tax liability for all small businesses, which of course many physician practices are, but there's also a certain provision in there that relates to the purchase of vaccines.
Right. Actually, House Bill 500 is the bill. In the House version, there's a provision that basically says that vaccine, the cost of the vaccine, the purchases don't count towards your business. It's somewhat unfortunate that doctors who are trying to provide vaccinations to their patients are having to pay tax on obtaining and keeping the vaccine. So we're looking to reduce that and eliminate it, actually. So it's in the House version. It's not in the Senate version. They are in conference committee currently, and we're hoping that we can keep the provision that the House has in whatever the final solution that they come up with.
So we got 3 days left. If you go back and take a look at our agenda, it's been an excellent session for physicians and patients, and hopefully we'll be back in another week or two with a more comprehensive look. Thanks, Darren. And
thank you so much.
Great job. Get back to work.
Okay.
Thank you both. These legislative successes happen because of physicians like you and all the family of medicine who tell legislators what patients need and what doctors need to care for patients, and how legislators can help pave the way. Here are some pretty impressive numbers. Nearly 50 TMA physicians testified to House and Senate committees this session, urging support for bills to help patients and physicians. And several stars testified repeatedly. By the way, this image is TMA board member Dr. Doug Curran testifying before a House subcommittee. And more than 1,000 physicians, residents, medical students, and TMA Alliance members participated in the white coat invasion of TMA's First Tuesdays at the Capitol this session. TMA applauds each one of you who made the sacrifice to leave your patients, your offices, and your homes to participate in the process this year. TMA's advocacy staff reminds us that your visits with legislators and their staffers make a difference, helping to pass the bills that are good for patient care and challenging the ones that are not. Finally, I would like to thank the many TMA physicians who visited our new studio this year to help tell the story of this legislative session. Your contributions have been very interesting and informative. That's it for now. I'm Brent Anir. Thank you for watching, and please join us again soon when we wrap up the session on TMA's Legislative News Hotline. See you then.